Hello again, thank you very much for joining us, and we begin from the former Communications Minister Dr. Edward Omane Boamah, who has called for special training for physicians in training to handle emergency situations as the number of Ghana's COVID-19 cases increase. Ghana's case count now stands at 2,000 with over 2,000 with 18 deaths. Speaking on the Super Morning Show a while ago, Dr. Omane Boamah explained why Ghana's recovery cases and deaths are low.
Our health systems are not as robust and strong, resilient, adaptable as that of the countries that I have mentioned. And you can imagine if, God forbid, it should never happen to us, if we have 50 or 100 cases that require emergency care and that require ventilators that will be dedicated to them. Let's not forget, we cannot also assign all the ventilators in the country to COVID-19 patients who need them. So whilst we are at it and looking at all these, we need to plan. And if you also look at the trajectory, our numbers are rising. Unfortunately, the curve, the graph that we see is not too helpful in terms of predicting whether we are dropping. In terms of dropping, we know we are not dropping, we are rising, but plateau, because there was a point that the graph had shown a certain horizontalness, which elsewhere they would have said, oh, we are plateauing, so it looks as if.
But then we started rising again.
It's because of the inherent challenges in the way our testing system is being managed. So at best, you can put the overall effect of the stepladder graph that we are seeing together and say that, look, the cases are increasing. So even if the mortalities are low here, even if the number of cases that are developing the crisis are lower than the expected percentage, the rise will definitely impact on the total number that will need emergency care. And because of our peculiar situation of having just 67 ventilators within the entire public system, minus the private sector, and maybe if the 20 that a government said
they've ordered,
they ordered are in, then maybe we have 87. So you can imagine what will happen. It is not just also about ventilators. If you're looking at health systems, it's an overall thing. It's about infrastructure, it's about the equipment, and most importantly, also about the human resource. Do we have enough anesthetists? The kind of Prof. Dujanfi, Dr. Chris Owu, Dr. Cornelia Kwaku, Pum, and several others who can really, on the spur of the moment, take charge and respond to the needs of such critically ill patients. Do we have enough respiratory physicians like Dr. Audrey Forson and a few others to take charge and respond to this? Perhaps we should also be looking at quickly shifting some physicians in training, or even some who have completed their training, and giving them crash courses in emergency medicine, awaiting
the arrival of more ventilators.
A remote possibility, which we all do not pray for. So I say that the numbers in terms of deaths are lower compared to the cases that have been confirmed, but because our trajectory is on an upward trend, we need to be careful and not just relax.
Doc, why are the recoveries also so low?
The recoveries, we need to also compare carefully. Unfortunately, but that is what can happen. The standards that are being used vary. So if you decide that in terms of recovery, you are not going to use additional tests, and if those additional tests are negative, then you conclude that the person has recovered. Mm-hmm. But you are going to use symptoms abating and the person being determined as cured at the end of 28 days, at the end of 21 days and all. One may be recording higher recoveries, another may be recording lower recoveries. Right. Let me cite an example. South Korea has recently realized that what they mistook for reinfection was rather fragments of the virus that the PCR had picked in those cases, and so they felt they had been cured. They went back into the community and got reinfected. You understand? So these can obliterate the numbers. Be that as it may, there are still human beings to these numbers, and that is the most important thing. Yeah. Whether low or high, one death is important because it is a father, it is a mother, it is a child, it is a chief, it is a queen mother, a teacher, a doctor, a lawyer, a journalist, a farmer who may be dead.